you actually have to like just compress it, like you juice it out, just to get the essence. And you carry that as a foundation to enter workplace. So dry needling is like a safer, more effective way to like target really the deep tissue. We call it trigger point. I also treat some athlete. I learned FRC to help this group of people. It's a method of, I would say, exercise to bulletproof your joint. I think in Malaysia by 2030, 15% of the population will be 60 years old and above. Everyone in the world is talking about it, like how to age gracefully.
Welcome to today's episodes of the 𝐻𝐸𝐻 Talks. We aspire to inspire you through a series of conversations that we are going to have with different people from different industries and different educational backgrounds. For those of you who don't know what 𝐻𝐸𝐻 Talks is about, you can watch the introductory video. We'll put the link in the description box below. My name is Hiran. I will be your host for today. I am an educational consultant at 𝐻𝐸𝐻, which is a university placement agency. For more information about what we do here, you can scan the QR code. Joining the conversation with us today, we have Felicia Tung.
Hi!
She has a bachelor's degree in physiotherapy and has been practicing as a registered physiotherapist since 2018. She's currently doing her master's degree in Healthy Aging and Rehabilitation in one of the universities in Norway. She's also a certified functional range conditioning, mobility, and dry needling specialist. We'll find out from her what are these about later on in the conversations. So Felicia is going to share with us her journey of becoming a registered physiotherapist in Malaysia and also her working experiences in the industry. So thank you so much, Felicia, for being here today.
Thank you, Yuran, for having me.
Thank you. So first of all, why did you want to study physiotherapy?
My story goes like this. Right after SPM, I did foundation in science because I already knew that I wanted to be in the science field and not anything else like engineering or accounting. So towards the end of the foundation in science, where I started searching for the courses that I want to do my bachelor's in, it was through a process of seeking advices and a lot of like funneling process, elimination of what I don't want to do, and oh, this is what I want to do, and I'm just like taking step by step. And among the processes was like asking advices from my relatives, and they told me like what's good about my personality, what suits my personality. So they say I'm a kind person, I'm patient enough to deal with people, and I'm compassionate. So they already like put in my mind like, hey, you have a talent for doing people job. Yeah, so I was like, okay, that sounds like me, that sounds cool. Okay, so, but since I already, I'm attached to this university, I looked at the options of health sciences from this university. They had medicine, doctor of MBBS, so they had traditional Chinese medicine, TCM, and then there's nursing, and then there's physiotherapy. So I went through all the brochures and I checked them out, I read. It's like, then through elimination process, like, I think being a nurse is too stressful for me, I can't take it. Or if like traditional Chinese medicine, like my Chinese is not so good. So, yeah, so I can't do that. I was like, okay. I was like, physiotherapy, oh, what's that? It sounds cool. So I went through the, the subjects. I was like, okay, I can work with this. This looks good. This looks cool. Not too hard, but I think I can take it. And then yeah, so that's how I found out that okay, let's just choose physiotherapy and let's stick with it. I think I can do this.
What is so cool about physiotherapy? Because you say that, okay, yeah, this is pretty cool, right? I think I can do this. Like, what speaks to you then?
Okay, of course I did further research. But the first thing that caught my attention was in the brochure, there was this picture, a guy in a white coat, and he is somehow like guiding this person in a parallel bar, like teaching that person how to walk. Yeah, so this is what caught my attention at first.
All right.
Yeah, rehabilitation.
So like, as you are going through the course, does it match your expectations, or what is it like?
Initially, yes. So my course is about 4 years. The first 3 years is mainly theory. So you learn about anatomy, physiology, general pathology, all the stuff that you would need to know about the body.
It's quite medical.
Yes, in fact, we study with medical students.
Oh,
yeah, certain subjects, especially nurses, we do the same thing, especially in the first year, because the foundation is the same. You need to know about the body, right? And then in year 2 and year 3 onwards, we actually had to go deeper into physiotherapy. So we learned what is normal, what's a healthy human being, and then we learn what is the abnormal abnormalities of a human body. Example, like diseases, sicknesses.
You mean in the physiotherapy?
Yes, we're going deeper into physiotherapy per se, not so general anymore.
What are the abnormalities of physiotherapy of the body?
The body, yeah. So in physiotherapy, basically we deal a lot with movement. So like the common examples would be if through a disease. Example, you have stroke. You get different type of stroke. You get hemiplegia. You can't move certain parts of the body. You're into an accident and you lost a limb. And then how you're going to learn how to live your life with a lost limb without losing quality of life. Yeah, so basically rehabilitation, bringing your current situation back to as before or even better. Yeah, so that's
interesting.
interesting. Yeah.
So the first 3 years is theory, and then the last year, what did you do?
Okay, so the final year, we call it just posting for short. So it's basically going to hospitals, basically interning lah. You get to know what is going on in the hospital. So it's like the practical hands-on skills. You get to meet patients firsthand, communicate. You get to see what's it like working in a hospital, working with real-life patients. It's not just theory, because theory and practical is different. Yeah, so whatever you study may be useful, may not be so useful, may be different. Yeah, you need to learn from someone. The ropes.
Did it match your expectations from what you saw the guy from the brochure?
Yeah, okay.
It did?
Yes, of course. That is like the ultimate. If you look at that, it's like, oh, that's a physio. That's like the trademark. Yeah.
So like you literally, like the expectations. So this is what I'm doing right now when you were posting in a hospital.
Yes, definitely. Of course, that's just a picture, right? It's just like one frame, but in the background there's a lot of grinding, like hard work to do to get the patient moving again. Yeah.
What are the challenges that you come across as you are going through the course?
Like, of course, in the first 3 years of studies, you have the study challenges. Example, you have to face some stresses, group works that are tough, you have exams that are tough. So in medicine, usually we have this thing called 𝐁𝐸s or 𝐁𝐸s. Basically, it's an exam to steer you towards clinical or practical work. So it's slightly stressful. You have vivas as well. So basically, you're given a scenario and you read like, oh, Mr. X, 60 years old, has undergone an accident, a fracture, So the question will be like, okay, so how are you going to assess this person? And you have a model there, and your lecturer sitting in the room with you.
Wow.
Okay, and then you just have to, you have to practice dealing as if you're dealing with a real patient. So that's a little bit stressful when you don't have any experience at first. Yeah.
So that's the challenges.
And then when you go to the practical world, that's a different stress altogether, because now you're really hands-on, right? So you're going to face a lot of people problems. That was book problems, and now this is people problems.
Okay.
Yeah, learning how to deal with like a senior who doesn't help you as much as you hope they would help. Patients who are just angry, depressed, because they're always in the hospital, right? And they're sick. And when you go and you want to do your best for them, but they don't, maybe they lash out on you or something like that, and you have to take it. Because they are patients anyway, you have to show empathy. So sometimes these are the challenges you will face when you are dealing with people in the hospitals.
How do you manage it though?
I keep telling myself that, like, I'm just visiting the hospital, but you don't really live it. You don't know what they're suffering, and
So like the day-to-day.
Yes, they go through so much more.
Okay.
So you have to understand, be extra empathetic towards them. Even the doctors who maybe they don't treat you so well, they're like, oh, you're an intern, or you're like just posting, they'll leave you alone, they don't teach you as much. But you have to understand that these people, they are working very hard.
So what did you do after graduation then?
I went to apply for jobs, of course. It was slightly before graduation per se. So we were in the last semester, and even the lecturers, they do prep us like, okay guys, you can start, sending out resumes and applying for jobs.
You mean the last year or the last semester?
Last semester.
Oh, the professor actually
not just, promise.
Yeah. Wow, okay,
to get us ready for the real world, right? You're graduating, so you have to go into the workforce. So yeah, we did. So we actually prepared our resumes, And yeah, we have references as well, right? So we use the lecturers' names, and then we just start sending out. And then I actually got offered a job in a private physiotherapy center, and that was my first working experience. Yeah.
How was it?
I'm not sure if it's a common thing. Most people's first experience is not really a good one. I don't know why.
Yeah.
So it wasn't a good one for me either, but I learned a lot. Learned not just physio work, I learned people skills, communication skills, yeah, like
Your interactions with your colleagues, how you manage time, how do you work with them.
Yes, correct. Yeah, these like soft skills. It wasn't very pleasant working experience, but I'm eternally grateful for it because that built my foundation, you know, it toughened me up, I guess.
Did you stay there for a long time? Or?
No, that's why I did not.
Okay.
Before the probation, I just left. I said thank you, and then I left because in fact that experience demotivated me to almost stopped me from becoming a physio.
Oh wow.
Yeah, because number one, I wasn't learning much. Like you're doing physiotherapy, right? So in that center, they're doing it the old school way, the textbook way. It wasn't anything new. So we just applied whatever we learned, and they left us all alone. You just do whatever you want with the patient. Like maybe they'll guide you a little bit here and there, but you don't exactly know what you're doing. Is it helpful for the patient or not?
So there's no supervision.
No
checking
proper supervision.
Okay.
And when you ask questions, they don't really explain why. They don't satisfy your curiosity, but you're afraid to challenge as well because you're so new, you're so fresh, right? Yeah. So.
You say that demotivated you from actually almost stopped you from becoming a physiotherapist, right? And then what happened next that you say, you know what? I really want to do this.
Yeah, because I found my second job. So after I quit, and I'm grateful for that experience. So I immediately, after the third month, the fourth month onwards, I got into another private physio center, which is like totally like 180 degrees like difference because the boss, the mentor is so generous with his time to like actually have all this East continuous medical education. Like every week they'll have like a group of a meeting. Like okay, today we're gonna talk about osteoarthritis, and they keep teaching you, revising. So they actually like a mentor
On a weekly basis.
Yeah.
Do they do that for newcomers or new staff?
Yes.
They do it specifically just for
Yes. It's part of their training, in fact. This is so good. It's so good. And it totally shifted my perspectives. Like, so this is what a proper, physiotherapy center should be doing to like grow the young staffs, to become proper physiotherapists, So the mentor is really kind because he has had experience. So he is transferring all the experience, like hands-on, how to view the body in a different way, biomechanically. Like, so these are the people's problems and their complaints. Okay, how you're gonna treat it using your hands and using the new knowledge or using different new tools, techniques, rather than just, using machines, simple exercises that doesn't get the patient better.
Because you say the first center was pretty old school, textbook based, and the other one, they constantly trying to bring, educate you, train the new stuff about new techniques and new perspective in physiotherapy, right?
Yes.
So how much of what you learned in universities, you actually applied it to your job then?
Throughout the years of the course, you actually have to just compress it, like you juice it out, just to get the essence, and you carry that as a foundation to enter workplace. Yeah, you need to know anatomy. You have to, and you need to know where your bones are, your muscles, your nerves, blood supply, what sicknesses, and what are the precautions of these sicknesses. Yeah, so these are your foundation to bring you into work. But like
you
I
build
said,
up from there.
Yes, correct.
Okay.
So, but it's definitely compressed lah. Because theory and practical is a very different thing. Yeah.
So, are you still working with the center, the second one?
No, unfortunately.
Okay.
Yeah.
So later on, where did you go then?
Then after that, I actually freelanced as a physiotherapy.
And you're still doing freelance right
Yes,
now?
I'm still doing freelance right now.
So like in the beginning of the video, we actually said that you are a certified functional range conditioning
FRC, yes,
right? And then you also use dry needling.
Yes.
How did you pick up these techniques then?
Okay. So, of course, like the first initial exposure, it came when I was actually in my studying days. I actually entered this conference in Hong Kong. So they have invited speakers, right? So one of the speakers was the guy who taught dry needling. So he shared about dry needling, he shared about the research on it. So I was like, oh wow, pretty cool. But I was just said, pretty cool. And so when I came to work, and then I have like these seniors who also did dry needling, and they used it to treat patients, and patients got better. I was like, hey, this is cool, this is new. I want to learn it too. I want to do this too. And so that's when I actually like looked up the web. I see where are the providers in Malaysia, and then I registered for it. But then that was dry needling. And then for the FRC, functional range conditioning, this one also recommended to me by another senior. So you see, support in physiotherapy is very important, because otherwise you don't know where to go. So coming back, so this FRC is only offered overseas. They don't come to Malaysia yet. So I had to go to Singapore for this certificate.
So you did dry needling certifications here in Malaysia?
Yes.
And then for FRC, you had to go. Okay. Like, how do you pick like the techniques that you see, like determine that these are the techniques that I want to use of all the techniques out there?
Honestly, it's the patients that motivated me. You want them to get better, right? So you definitely need to help them get better. So at first it was just hands-on, soft tissue manipulation, mobilization exercises. Yeah, that's good, but sometimes not enough. So dry needling is like a safer, more effective way to like target really the deep tissue. We call it trigger point dry needling. So certain pains, it can be acute, it can be chronic, is caused by all these trigger points, which can be solved by dry needling. Yeah, so most of the common pains that majority of the working people have, it's from muscular tissue. So that's why I learned dry needling to help them. I also treat some athletes, so they do a lot of physical work, right? So they need to protect their joints, you know, from injury, because you don't want to sprain something and you don't want to overuse something, so much so that it stops you from the sport that you love so much, right? So you have to learn to protect the joint, learn how, the technique. So I learned FRC to help this group of people. And so basically it's the patients who motivated me to get all these tools in my pocket so that I can help them.
So how do you do dry needling, or what is the process like?
So first I'll feel for the muscle that is tense. You'll have this taut band, such as these little, you can feel like it's a knot, right? Yeah, so this is a knot. That is where the trigger point most likely is, at the bottom. So, but first of all, we have to know where the muscle is lah. So once we've identified the taut bands, that's where I'm going to put the dry needle in, because that's most likely the trigger point. And so this is the alcohol swab. So I'm just going to clean that area because I'm putting something in, right? So you want to make sure that area is clean. Okay. So the area has been cleaned. Alright, so the next step, I'm gonna try to pick up that muscle, because you only want to needle that point. You're not gonna try to touch anywhere else. So during that process, the grip may be slightly uncomfortable, but should be alright. I just explain, yeah. And then I'm going to go into just that muscle, and I'm gonna pop it in. You're gonna feel a pinprick first. Then after that, nothing. Okay, twitch slightly. Just let it twitch. Just relax. And I'm going to search for the trigger point now. Just relax. Beautiful. It's moving. Let it contract. 10, 9, 8. Yes, just a little bit more. Okay, it's coming out soon. Getting good. Twitches right there. It's gonna relax. Okay, 3, 2, 1. You're gonna feel so good. Coming out. Excellent. Okay, so that's the process of dry needling of, we call this muscle the upper trapezius, yeah? Okay, there you go.
So, like, what exactly is FRC then?
It's a method of, I would say, exercise to bulletproof your joint, because it's to control mobility and have strength at end ranges. So each of our joints, we have a normal range, but you know, athletes, they go they go wild, right? They go crazy. They like bend everywhere, and they do
as much as possible, right?
They reach their maximum potential, which is probably part of their sports. Example, gymnasts, right? They have to like flip everywhere, right? Which is not what normal joints could handle. Okay, so FRC is basically a way how to strengthen your joints, or particularly strengthen that movement that you're supposed to make, so that when you ever faced with a stress, when you bring your joint all the way to the stressful end, you don't break anything. You may have slight injury, but it's to mitigate the injury, just to cushion yourself, so that you don't actually injure yourself permanently, requiring surgery. And after surgery, you don't go back to sport, and it just saves you a lot of trouble.
Great. And so you are currently doing your master.
Yes, I am.
And why do you want to further your study?
Right, so I'm actually doing my master's in Healthy Aging and Rehabilitation. Honestly, the process was also by chance, but I researched a lot on the internet. I didn't go through someone. I actually searched on it on my own. But the main reason why I wanted to do a master's in the first place was to advance my career. Because as a physiotherapist, I feel like there's only so much we can do. Yeah, which I don't want to just stop there. Yeah, you have to be able to grow the field, especially if you want to contribute back to Malaysia. The physiotherapy status, I would say, level of it in Malaysia.
Okay.
Yeah.
And why did you pick Healthy Aging and Rehabilitation instead of Master of Sports Science or Physiotherapy?
I actually had a dilemma for that. It's like, oh, should I do a physical activity or like sports related, since I'm already doing, so much, or healthy aging? The thing is, healthy aging, I'm actually drawn to it after I read the subjects, and because it's actually a global trend right now. Everyone in the world is talking about it, like how to age gracefully without so many diseases, which saves you a lot of money, effort, and pain when you're in the older age. Like Japan, it's an aging country, and how they're going to cope with it, because statistics show that I think in Malaysia by 2030 or 2050, if I'm not mistaken, 15% of the population will be 60 years old and above. And 60 years old is a retirement age, right? That group of people are not going to work, not going to generate income for the country, and we will have to support this group of people.
So that's going to be a lot of health issues popping up as well.
Yes, correct. So what are we as the young, professionals, helping, healthcare, to prepare us for that age, because it's going to come whether you like it or not. So how prepared you are to take on
Interesting.
Wow.
Okay. But why did you pick Norway though? It's not a common country that people would thought of, like, hey, I want to do my master in Norway. Yeah.
But this, like, if I'm not mistaken, like healthy aging, this little keyword, right, is only if I'm what I could find out at my own capacity, was only offered in Norway, because the rest is like physical. The rest are just like sports, like focused towards the, I would say, mainstream. Then the not so mainstream is like Norway, but that's only the first reason. Second reason is like because master's education for international students are pretty affordable there. But of course, the living costs are high. So I think that was the thing I was willing to take lah. Like if education's low costs, but your living fee is high, okay, it balances out. I can still take that. So that's why I chose Norway.
Wow, you
that country
did a lot of research on
I did a lot of research on my own.
Wow.
That was stressful.
Did you ask anyone else for advice?
Because I did not know of anyone.
True.
Like, who
Such a niche area.
It was very niche. My friends who took masters in physiotherapy, they're all done locally lah.
Being a female physiotherapist, right? In terms of physical strength compared to your male colleagues or seniors, do you think it's a disadvantage?
I know that this is a perception going on right now, because when you think physio, you think like, oh, you need muscular, big bulk to lift patients and stuff like that, right? Yes, true, but to a certain extent, because what's more important is technique, knowledge, and basically skills. So you need to utilize your whatever strengths that you have to make it happen. So it's actually just a perception. It's not exactly true.
Do you come across that very often?
Yes.
How do you deal with that?
Clients always say that, oh, you're so small size. I can't imagine you have that strength. Or sometimes they'll be so curious, like, oh, what tool are you going to use? I was like, no, like hands. I was like, oh, they're so surprised because sometimes they're really huge and they sort of doubt you. But once they go through the physiotherapy session with me, then they'll be like, oh, okay. So it's not strength. What do you call it? Like raw strength per se. It's more like technique, how you angle, how you find the point.
So you don't really need a lot of muscle strength to actually have very high pressures.
Yeah, no. In fact, if you hit the point where it's accurate, you can just put a finger on there and it would be painful as... Oh man, yeah. You don't need a lot of strength. That's a misconception that people have.
Alright.
Yeah.
You've worked for quite some time, right? We have talked about your challenges of going through the course. And now, since you have been in the working industry for quite some time now, what are the biggest challenges that you have actually come across?
Because I'm dealing with so many people, I would say first thing is maybe people problems. So that's why communication skills are very important. Like how you respond to questions from clients.
Those are the challenges you face.
Yeah.
And what are the rewards that you receive then?
Actually, when the patient recovers, that is like the only source of like joy. It's like, oh, okay, I live for this moment when they feel better, they improve, and you can see them moving better, and they thank you, and then they just show their appreciation, and you feel like, I actually feel like a teacher, you know, when your students graduate and then like come back and say, thank you, I'm successful now, thank you so much, I can do this now, and then you feel like that satisfaction. So that's what I live for actually.
Wow.
Yeah, that's what keeps me going.
Is there like a case example that you can share?
So there is this elderly, I think she's about late 50s. So she did total knee replacement for both knees at the same time. Because they heard some advice from someone, oh, it's good, just do it one shot, you know, save your time for rehab, just do it one shot. And then the next thing she knew that, oh, she can't walk because both of the knees are so painful, and so she had to she had to be brought home in a wheelchair. And of course, wound healing takes time,
especially at her age, right?
Yes, late 50s, healing's a bit slow. And so I saw her from, I think, the first week out of hospital, when she was still in bandages and the scar is still pretty fresh. But she had trouble going to the toilet. It kind of demotivated her because she thought that, hey, after surgery I should be walking better. Like just like that. No, it's not. So you have to have you have to guide the patient like what you should expect, you know. After physio, after surgery, you educate the patient. So I educated her, and then I did 10 sessions with her. So step by step, I'm like a motivator, sort of like, you can do it. Like the pain, is it very bad? Because if it's not, it's good pain. You should go bend the knee, learn how to get up. So she's always like, I cannot do this, I don't have strength. It's so painful. Like you have to basically encourage her, yes. So after 10 sessions, she's able to walk better, downstairs, go to the toilet herself without relying so much on her grandchildren to help her.
Those are like simple things that we do every day, right? And then all of a sudden when you can't do it, it's like your
quality of life just drops. You'll be so like depressed. You'll be like, I used to be able to do it so easily, and then after an incident, I can't do it anymore. I think that's partially why when it's a successful physiotherapy session, people are so grateful.
Yeah, of course.
Yeah.
Wow. Okay. What are the tips and advice that you have for students who are thinking about going into this field?
Manage your expectations well. Like you have to know really what you're going into. So basically do your research, because like example physiotherapy, you have to know that it's not a glamorous job. You know, you can't have polished nails, you can't wear heels and skirt to do your job. No, you have to be in gloves, white coat, and you have to get down and dirty, because sometimes in a hospital it's not pretty. You have to deal with a lot of comatose patients, amputees, you know, dead skins, unpleasant smells. So So these are the challenging times where people be like, hey, this is not what I wanted, then you quit halfway because you didn't manage your expectations well.
Well, thank you for sharing that. And what do you think of the current physiotherapy industry in Malaysia?
It's definitely developing, both in the government sector and in private sector. People are getting more and more aware of their alternatives. Like, it's no longer, oh, if you're sick, maybe physically, you go see a doctor, take painkiller, and if it's not solved, you go to a surgery, get surgery done. So this was the traditional way. Now you have so many options. You have physiotherapy, you have other alternative health sciences like chiropractic, Chinese medicine, osteopathy, so many. So physiotherapy is one of the growing, I would say, bigger. Why? Because physiotherapy is actually available in government hospitals. It's just that it's in the private sector, it's slightly different.
What's the differences?
So because in the government hospitals you have heavy workload, right? Hundreds of patients day in, day out. So there's no really one-to-one attention between therapists, but it's just due to the system.
You probably can't do the encouragement that you did with the old lady.
Yes,
right?
Correct. Yeah. So in the private center, whereas you have time to be with the patient, so
to really get to know the patient.
Yes. So so the system in Malaysia now is growing, and that's why it also needs more quality control, especially in the private sector. So we have this Allied Health Professions Act. It's still pretty new. It's still being stabilized, I would say.
How new is that?
It's actually, I think, if I'm not mistaken, it's 2016. But if you just ask friends who are practicing, not many of them know. That's why the MPA, Malaysian Physiotherapy Association, has to play a better role,
in rolling out this. Okay. All right. Yeah. One thing that you wish to know before you step into the industry?
Honestly, I wish I knew how, I would say, rewarding the feeling would be. Yes, because you get, this is not words from my own, and people tell me that, people say like, oh, your parents are so blessed to have you as a physiotherapist at home, any problem you can handle for them. So these are what people tell me, and I was like, oh yeah, that makes sense, and that's so, isn't it touching? I feel like it's so touching. So I wish I knew how rewarding it would be. Yeah.
Wow.
Then that would actually motivate you to maybe do better.
And improve yourself.
Yeah.
Upskilling.
That would be, upskilling. You're willing to invest. It's not cheap, the dry needling and the FRC. You have to go overseas for it. It's a lot of money spent, but it's worthwhile, The return of investment it's worthwhile.
Take that, students. And what's next for you then?
I do plan to complete my master's on time, hopefully. And then after that, I actually like to be in Malaysia, because I actually look to maybe start my own business. Yeah,
having your own private center.
Yeah.
Oh.
And doing physiotherapy, incorporating whatever I learned, healthy aging, and just bring that back in Malaysia here.
Cool. Yeah. I'm looking forward to that.
Thank you. Yeah, sure. You know where to find me.
Yeah, I do actually. So, anything else you want to add to the audience?
Find your passion, know your passion, and follow it. But also at the same time, just be wise, so that whatever you're choosing is gonna be your life, career. Don't take it too lightly, but at the same time, don't be too heavy upon it. Just follow your dreams, feelings. That's what people say. It sounds cliche, but that's actually real, because that's what's gonna carry you throughout your career if you want a long-lasting one, right?
Yeah.
Yeah, that's all.
Right. Thank you so much for sharing your thoughts, vibes, and experiences with us today. Felicia is currently working as a freelance physiotherapist. So if you would like to get in touch with her or book a session with her, we'll put her contact information in the description box below, where you can book a physiotherapy sessions or even try out the dry needling sessions with her. So drop us a message if you would like us to guide you in terms of how to apply to a physiotherapy course, what are the entry requirements, scholarship availability, or if you need recommendations for universities. So our educational consultants are more than happy to assist you. That's it for today. So thank you so much for watching it, and we'll see you in the next episode. Bye!
Yeah.